Hey, long time no see, strangers. Yes, it has been a while since I've been on, but today's focus will be talking about chiropractic care, more or less energetic chiropractic care. So one of the chiropractors that I collab with, he is an energetic body worker. His focus is mainly working with the emotion, the posture, the breath, the body language. It deals with a lot of physical, mental, and emotional. He does not do manipulation, no cracking. It's just energetically light touching on the body. And in the next videos, you'll be getting a testimony from one of his patients for a year's time. And then he'll be demonstrating on me on what to expect. But he works with the innate intelligence, or another word for inner physician. It's when we facilitate energetically, where if I'm treating somebody, my innate intelligence or my inner physician facilitates your energetic field and brings it back to balance. The body knows how to go back to balance, but sometimes things get mixed up and life changes happen and we become unbalanced for whatever reason. So there are energy workers out there that know how to get you back into alignment. But with Dr. Paul, he started his journey in holistic healing many years ago. He started in engineering at first. That was his first education, going to college. And then it shifted. He had an awakening, and then he got into chiropractic, being treated as a patient, and then later decided, this is it. Like, I'm feeling so much better. He lost over 100 pounds. He started getting into yoga and meditation and Chinese medicine. And that's when he decided that he wanted to help heal other people. So he got his doctorate at the Sherman College of Chiropractic Care, I guess, south from Asheville. It's in South Carolina. So yeah, stay tuned in the next clip and you'll receive and be able to experience a testimony as well as a demonstration. All right, this is Paris, and he's going to give his testimony on the energetic chiropractic with Dr. Paul. Thank you for giving your testimony.
Oh yes, my name is Paris, and I've been getting network for several years now, and I've been getting specifically work done by Dr. Paul over the last year, and everything about my life is more organized. The way that I feel, the way that I breathe, just the way that I move, everything has changed and become more coherent. I had been diagnosed with post-traumatic stress disorder, and I had different type of therapies and went to the VA for all different types of remedies for this condition, and the only thing that ever seemed to really help me was network. And I've seen a lot of different chiropractors out there, and Dr. Paul is one of the best. And I'm just really happy to be underneath his care and to continue to upgrade my system.
Awesome, thank you. Just a quick question before we finish. What are some of the things that a person can expect during their session? Like the type of, you feel the difference, or while you're under a session, those kinds of a thing?
When you're under a session, it progressively becomes, it's like you're being tuned like a piano. That's the best way I can describe it. At first it's real subtle, and then over time you're more sensitive to it, and you're able to feel it go through your spine and through the other energy points of your body, and you just feel the energy literally reorganizing all your different cells and your subtle body. It's kind of hard to explain without experiencing it.
Yeah.
But it's like, think of it as your body being stressed out in a way that makes you function better without you actually doing the stretching, but the energy doing it for you. I guess that's the best way I can describe it.
That's great. All right. Well, thank you so much, Paris, and you have a wonderful day. Okay, and we're back. So this is Dr. Paul, and he's going to be doing an energetic chiropractic adjustment, I guess you would call it.
So the official term is entrainment.
Okay,
because
entrainment.
It involves everything within the spine at once. It's like a global system rather than just looking at an individual vertebrae. We are looking at both instead.
Okay.
So
What do you want me to do?
So I would love for you to lay face down on the table
All right.
and relax as much as possible.
Do I need to take anything off? I mean, like jewelry-wise, or am I okay with?
With what you're wearing now, that's fine.
Okay.
If anything starts to bother you, just let me know and I will gladly put it on the table.
Okay.
If you were wearing shoes, for instance, you take those off, and if you were wearing a belt, you would also take it off. So what I do first is the analysis portion of what tension pattern you're holding in the body at the time. We want to turn any tension pattern, not get rid of it completely, but turn it into a gift rather than something that's detrimental. Something can be too tight, like a guitar string, and it's going to sound terrible. But if it's toned and tuned just right, right now I'm going through the passive tension of the body here. All the way down to the sacrum, all the way to the coccyx, the tailbone. The reason why is the tailbone isn't just a static piece of bone that hangs off of the sacrum. There's actually several there's at least one ligament, coccygeal ligament, for instance, that connects directly to it. Also, there's a couple other ligaments that the name escapes at the moment because it's not at the proper time. I'll be able to say it as soon as it is there because it is another part of the analysis portion. So the coccyx can actually have stress on its own. So after I feel the muscular tension and the spinal tension, I then come here and feel the actual tension within the ankles. This actually helps see the tonal tension on the spinal cord within the spine. If there's tension in a certain area, it'll actually project into the ankles. So right now, for instance, if I come here, I'm not finding much tension until about 1, 2, 3, 4. There's a little bit of tension at the lower cervicals, and then once we get to sacrum, I'm feeling that. A little bit more lateral bending, but that one's pretty good. And we come here. What's up, so coccyx. Okay. A little bit of C2. So now I look at check leg lengths. I find that her left leg is a little bit shorter. Basically, I'm going to go breeze through this a little bit, but pretty much turn your head left, and then right, back to center. If you noticed before, I was saying that sacrum, basically I wasn't finding tension until sacrum. I was finding that bilaterally, and I was finding also that her leg did not shorten until I picked the leg up like this. And now I can see that what was once short on the left leg, of course you aren't able to see from that angle, is starting to grow long. So what we're doing now is crossing this leg over this one and addressing the tension that's in the sacrum. And there are other ways to do this, of course, if the stress is a little bit too much on the knee. However, what I find is the SI joint, because of course the pelvis is not just one solid bone, and I have you bring your awareness here and bring as much breath and awareness and motion as you can. As you can see, she's breathing with her belly, helps bring more motion to that particular area. Once more on your own. Across the leg. Now I can recheck the leg lengths and find that both legs are balanced. Something that easy can make a change of 1/2 inch on the body. Now this is not a physical difference in leg lengths. It's all neurological in nature. For instance, if she were standing up, the feet, of course, would be balanced because nobody stands on one leg unless they absolutely have to. But when they're laying down, the body tries its best to keep the feet balanced as well. However, it allows us to see the tension pattern, so there's a lot more tension on the left side than the right. So now I'm reassessing here. Stay this way. Turn your head left. Okay, back to center. Now I'm looking at C2. C2 is the axis. It's the one of the vertebrae in the upper cervical. It holds up the atlas, and if we look at, it's basically this one of the heaviest and strongest vertebrae, and then the neck. It's what provides all the stability for your head. So, if you can tuck your chin just a little bit, I'm actually going to lower this down.
And lower it down this way.
Okay. Yes.
Is that better?
Yes. Yes, it is quite better. It's allows a little bit more natural curve. And what I'm doing now is finding places of rapport at C2. Instead of looking for places that feel stuck, that I'm then going to, that many people would then put a force into to get it unstuck, I'm looking for places where there's plenty of free energy. The breath might change once I go there. I may feel a little bit of rocking in that area. And this goes on basically like a little bit of the art behind network spinal. Is the idea of there's places in life where no matter how much energy you put into them, they do not move. Whether or not that's a relationship or a certain emotion that you have or a situation, there are things different for each person that no matter how much effort we put into, don't seem to necessarily work out well. While there's other things in our life that instead of being something that's stuck in a drain, is something that's an overflowing fountain that gives us, it's like it gives us happiness. It's like a hobby, for instance. People love to do their hobbies because they're drawn to them. And when they find that they're doing their hobbies, the stress of everyday life goes away. It enriches their lives rather than when energy is pumped into them. And it overflows into all other aspects of their life. Likewise, when we're here, I am looking for a place where just bringing the body's awareness to it, energy and breath can flow there. Like right here. Make a light contact, just this. That's as light as it is. The body's own system reacts. The breathing begins to change, regardless if I say anything or not. This is all your body's doing, not mine. The power that made the body can heal the body, so they say. It also converts the energy that was previously bound and then use it to reorganize the spine in a way that is more conducive for the life that you're trying to lead. So as the breath continues to build, what I look for is a breath that starts all the way at the sacrum and travels up the spine gently, rocking each of the vertebrae in turn until it comes to the top of the head and then comes back down. We can easily tie that into craniosacral. The same theories and the theories behind the fascial connection between the two exist for both techniques. Josh is the expert of this, so I'm not going to go in more detail without.
Well, you're a doctor, so it's okay.
Well, there's doctors in many things, and like I said before in the previous section of this video, it is, as long as you've focused on a field of study.
So with cranial sacral, I think that the same thing with the energetic chiropractor, we call it the inner physician. So my inner physician and your inner physician work together. And we're called facilitators and guides to help the healing process.
Yes. In chiropractic, the only difference is they use the different terminology of innate intelligence.
Yes.
Basically because they came up with the concept in the 1920s when language was, again, a little bit different. And the inner physician and innate intelligence are two words for the same thing, two labels for the same inner essence. Down here, I'm going to make one more contact. So that last contact was going directly to the vertebrae. I'd like to find one, but if the situation allows, turn your head right. Yes, back to center. That actually involves the sacrum to affect somewhere else in the body. In this case, I'm finding that C1 now has a tension pattern, often to do with worry or fear, but with how lack of tension there is in her ankles, for instance. She's not afraid for her life, for instance. That's just,
do you have people like that? Or is that a joke?
yes, some people
Oh,
can
okay.
actually have that.
Oh, okay.
And this is one of the reasons why this technique can help with PTSD. So tuck your chin as much as you can. Again, I'm looking for the place of rapport. Now I'm looking for sacro-thoracic correlation. When the sacro-thoracic correlation, in layman's term, is the upper back between the shoulder blades and the sacrum right here. And what I'm looking for is 2 points that connect to each other in a way where I touch them and all of a sudden the energy changes, the person may start breathing differently, and it's just the case right here. So what that's saying is that if I make a contact at this level of the sacrum, medial to the midline, I can affect right here because of not only just mystical energetic connections, those also exist, but I'm being a little bit flippant about it because there's also nerves that connect those in a way that maps the entire body for the brain to be able to see as well. There is a tandem between the actual physical portion of the physical body and the energetic portion. And what this is doing is tying an energetic portion and the neurological component to the same way. Hence why I can make a contact here. And it was probably very hard to see on there, but she actually started swallowing as soon as I came to this position.
Mm-hmm.
I just make a light contact here. And when I do, what that allows the spine to do, nice good breath, is actually utilize the tension that is stored up in like that vertebrae feeling tight, release it and use it for further change in the body as it drives that breath wave up the spine. What that means is we're directly changing tension into easiness, allowing the spine to reorganize itself and find greater integrity within itself in a coherent and energy efficient manner. So now that she's breathing, I've definitely made a contact on her before. That's why we saw a much better breath as soon as we did that. Each session is cumulative, and also progressive. Once you have no 2 sessions are the same, and each session should benefit your life essentially in greater effects. When somebody first comes in, we just want them to be able to breathe easy. And when they breathe easy, there's less tension on all the ligaments and on the vertebrae and in muscles. A good deep breath allows the parasympathetic system to kick on, allow for rest and digest. Many people, if they're under a lot of stress, for instance, will feel a little bit sleepy after this, but they're able to still go throughout their day. But it's the epitome of allowing the body to relearn how to let go of stress in the body. After this session, her body will remember that this type of breath wave, this type of breathing, is beneficial for allowing the daily stressors that we live in life to be able to actually relax in a way that directly affects the tension in the spine. So if someone was feeling pain, the body is then from then on able to better manage the pain in a way that allows for reorganizational healing. Instead of going back the way it was, because the way it was what led the ability to have the pain in the first place. You're essentially allowing the spine to evolve in its own way, kind of like upgrading the operating system of the spine. So from then on, you can handle better stress. So that, even though it didn't look like much, can make all the difference in the world. So that is the end of the session. If you would like to sit up.
All right. That was great. Thanks, Dr. Paul. Before we end, I just want to add my experience. I've gone through many, feeling a little dizzy, but gone through many body work and experienced myofascial release as a massage therapist and professional myself, like feeling all kinds of things, and energetically, I never shared with Dr. Paul any of the things that I was feeling within my body before we started. And I will say that they had gone away, and I have a lot of lower back pain. He was talking about the right side, fear stuff, just a lot of in and outside of the body, whether it be emotional or actual onset pain. I did have those, and now my lower back pain has gone away. Oh, okay. So I really feel like this method works for anybody. I also think that, we're no judgment free zone. So you have to find what works for you. And some people really like force manipulation, and some people don't because it scares them. And I know from experience, like, I like both, but I do also have a husband that does not like manipulation. It freaks him out, especially the neck cracking thing. And I also know, just within my own scope and just within my own research and stuff like that, even just neck cracking, can, manipulation, it can offset the access of the body. I don't know, how in depth you have or what you have to say about that, but maybe we could talk about that some other time.
Yeah, some other time.
But as far as body work going for me and my personal experience, going to a licensed rolfer, when I received rolfing because I had so much pain in my body, that when I was getting body work done, he did in fact say, your access, you have had a lot of cervical manipulation. And I said, yeah, how do you know that? And he went into explaining those kinds of things, and that for me is worrisome, and as it should be for anybody. But with all that and further ado, I appreciate that so much, and I hope we can help more people. We can bring some people that are interested in seeing Dr. Paul. And if you have any questions or concerns, feel free to comment below, or we'll go ahead and tag Dr. Paul, put in his contact information, and we hope to see you soon, and thank you so much.
Thank you.
Namaste.